A brand new consensus statement from our friends over at Sky. This time it's talking about the best practices for transradial angiography and intervention. And I'm with one of the people to put this together, Dr. Sunil Rao from the Duke Clinical Research Institute. And we're talking about a hot topic here when we're addressing anything that's radial these days. Can you give me an idea of what the new best practices are?
Sure. I mean, it's probably important to talk a little bit about the motivation behind why we decided to do this in the first place. And I think what we witnessed over the last 5 to 7 years is this dramatic adoption of radial approach in the United States and worldwide. And what we wanted to make sure was that we didn't want to have the enthusiasm for the procedure overtake the clinical evidence behind how to practice it. So we want to provide some guidance for physicians who are adopting radial approach or perhaps have been doing it for a while to make sure they're following evidence-based medicine when they do it. And we focused on areas that have randomized trial evidence behind it. And for areas where there wasn't randomized trial evidence, we tried to provide some common sense guidelines. I have no doubt that some of our recommendations will be controversial. Some people may not agree with them, but they are sort of expert consensus by people who have been doing this procedure for a long time. The 3 areas that we focused on is trying to reduce the risk for radial artery occlusion, which is still a consequence of doing the procedure. Trying to provide some guidance around when operators should start doing transradial primary PCI for STEMI, which is, the study suggests, is where the greatest benefit of the approach might be. And then finally, trying to provide some guidance about how to reduce radiation exposure.
For the patient and the operator.
Exactly, yeah. And those are the 3 areas that we really focused on. And then we provided some areas where we thought more evidence was needed.
Like the optimal antithrombotic strategy?
Exactly. So if you think about what the benefits of the radial approach are, one of the major benefits is really a reduction in access site bleeding.
Right.
It's not going to really affect non-access site bleeding. That's really a pharmacological strategy. And we wanted to make sure that physicians and operators that were using this approach were also thinking about the other aspects of risks that patients face. It's not just about access site bleeding, it's also about non-access site bleeding. Again, it's an area that needs more research, and there are several large randomized trials going on right now to try and look at the interaction between radial approach and various antithrombotic strategies.
I mean, one of the criticisms here I was hearing from someone was the fact that these previous clinical trials haven't used as much antithrombotic therapy for the radial approach than the femoral, and so femoral doesn't come out, has more bleeding, and that's why. Is that an accurate depiction, that there needs to be the exact antithrombotic route in order to really see what's the difference between the 2 approaches?
I think that's a fair comment, and I think that's why we mentioned that it requires more research. And we just presented a trial yesterday where there was very, very high rate of use of bivalirudin, for example, which has been associated with decreased bleeding in the femoral access approach. Over 60% use of bivalirudin in both a radial and a femoral arm of that trial. So we are getting some emerging data. And that data, as well as some observational data that's come out from the ACC registries, for example, does show that there is a synergy between radial access and use of antithrombotic therapy that reduces bleeding, that can in fact reduce bleeding risk close to 0.
So in summary, what would you say are the things that people need to know from this particular consensus document?
Yeah, so I think the big messages from this, if I could boil it down, would be that pay attention to radial artery occlusion. There are ways to reduce the risk. Make sure that you get very, very proficient with radial access. Don't be a hobbyist, because that will allow you to become proficient enough to realize the benefits for transradial primary PCI and to reduce radiation exposure.
And in order to take a look at the paper, please, to go for the consensus statement, see the journal Catheterization and Cardiovascular Intervention from our friends at Sky. And before I make somebody unhappy, in the October 22nd JACC, there's a supplement. You can read Dr. Rao's commentary on radial versus femoral access. Got to make sure I get that in there. For Cardio Source World News, I'm Rick McGuire.